Yes, Shivam, please start.
Okay, so good evening, everyone. I am Shivam Sinha, the research assistant of the SarvArogya the Rice Foundation. I will sincerely welcome you all to the webinar of the SarvArogya the Rice Foundation of the SarvArogya project. I welcome the Sir Venkataramanaiah sir to address the session. And over to you.
Thank you, Shivam. Um, Good evening, everyone. I'm delighted to welcome you all to the second webinar of SarvArogya, a research-based public health initiative of Sarvodaya the Rice Foundation. Also, I would like to extend my sincere gratitude to Prasad Institute of Medical Sciences for supporting this initiative. First of all, on behalf of the entire DRISE family, I would like to welcome Dr. S. Venkataramanaiah, sir, who is the Professor of Operations Management at the Indian Institute of Management, Lucknow. We are truly honored to have you with us today to share your insights on strengthening the public health systems through healthcare supply chains. But before Sir expresses his thought, let us first set the context right. Why this webinar? Why does healthcare supply chains matter so deeply in public health? So, the year was 1943. The Second World War was ongoing. While there was devastation across the world, the state of Bengal was also burning. The fire that had broken out was the famine in Bengal, which killed around 20 to 30 lakhs people. These people died not only from the starvation, but also from diseases such as malaria, cholera, dysentery, and smallpox. Why? Because essential medicines like quinine drugs were diverted. Logistics had broken down. The healthcare infrastructure had completely collapsed. So the tragedy was not the absence of treatment. The tragedy was that the treatment existed, but it could not reach the people. Even today, we continue to witness similar vulnerabilities. The ongoing conflicts in West Asia have disrupted the global trade routes. The prices of medical products like medical grade plastics have increased. And when the healthcare supply chains become expensive, delayed, or unstable, it is ultimately the patients and the struggling family members who bear the cost, sometimes financially and sometimes with their lives. See, the healthcare today is not merely a question of treatment, it is a question of access, infrastructure, storage system, transportation efficiency, regulation, and the struggle to reach the last mile. India today stands at a crucial juncture. We are not only one of the world's largest pharmaceutical producer, but also a country that has the potential to build resilient, equitable, and technology-driven healthcare systems for the future. And we are on the track. However, this Aatmanirbharta cannot be built only in laboratories or hospitals. It has to be built in the warehouses, transport corridors, digital networks, manufacturing ecosystems, and policy frameworks. And that is precisely why this webinar becomes important. Dr. S. Venkataramanaiah sir doesn't need any introduction, but Dr. S. Venkataramanaiah is the Professor of Operations Management at the Indian Institute of Management, Lucknow. He has a 30 plus years of teaching and research experience. He was a postdoctoral research fellow at the Singapore MIT Alliance program, Nanyang Business School, Singapore, and worked at the Honeywell, Singapore as an SCM lead engineer. He was also the Best Teacher Award winner, Fulbright Scholar at the W.P. Carey School of Business, Arizona State University, USA. He has undergone training on global participant centered learning at Harvard Business School, USA. He has worked at the IIT Madras and IIM Indore and IIM Kozhikode before joining IIM Lucknow in May 2013. Sir was also instrumental in the design and the launch of 5-year integrated MBA program at IIM Indore during the year 2010, which was unique in the IIM systems in India. He is the recipient of the Nelson Mandela Leadership Award, JagatikAyurvigyanSamman Award for his seminal work in the area of healthcare management. He has published 30 research papers in peer reviewed international journals, authored 4 book chapters, and customized a book on production and operations management. It is truly an honor to host you, sir, today. Over to you, sir.
Thank you, Sneha. Thank you, Shivam. It was pleasure listening to both of you about the program and about me. And thank you for such a nice introduction. And I don't think I need to celebrate that in any way. That is all past. So I look forward for some meaningful conversation in future and present and future. So those who can come on video, please switch on your video, and then Sneha and Shivam can take a good picture of it, and then they can use it whatever they want. Yeah, I request all of you to come on video, please, for a while. Those who can. Yes, please, others, quick. Sneha or Shivam, maybe you can take a quick picture and then, yeah.
Yes, sir. We have taken. Thank you.
Okay, right. Thank you. So thank you all. And let me take quickly through some of the things that I have been doing, what I want to share with all of you. So is my slide visible now?
Yes, sir.
Okay.
Yes, it's visible. It's
Right.
visible.
So I hope you all know what is the name of the topic. The topic name is Strengthening Public Health Systems Through Healthcare Supply Chains. Public health, of course, public health systems, and supply chain, and in particular, healthcare supply chain. We try to bridge or build a bridge between these two. What is the public health system? You all know, and I'm very happy to know there are people with PG qualification or pursuing PG, as well as the economics and policy studies, and public health. I think the mix is very excellent, Sneha. I must appreciate you for choosing such a wonderful mix. Though the group is about under 10, I think that is a very interesting group. So I hope you already know about my name and my affiliation. I'll add here my mobile number also. You can 8130831100. This is my mobile number as well. For any reason, anytime, if you want to say hi, you are most welcome. So, but still say that the reference point is the public health system program organized by Sneha and the organization that she founded, that is the RISE. And I think I must congratulate Sneha and her entire team and the kind of work that she is doing. And I had an opportunity to look at the report on her activities. Now I am going to see, or rather I got introduced to a small group of people through whom, or rather with whom her organization and her team is working. My sincere appreciation for you, Sneha, and entire team. So let me take you, though she has mentioned about me and my activities. So this is the just one frame about my journey. I have worked in number of organizations, both in India and outside India, particularly Singapore and US, and of course, to some extent in some parts of Europe as a visitor, not a long time. And of course, I was also working with Honeywell for some time on corporate research. And I'm also certified in lean healthcare. And I've also co-authored a couple of books. One is original book, another one is adapted book from US authors. And I was a Fulbright scholar on healthcare. That's why if anybody asks me, can you do a session? I'll simply say that I can do a session, but that should be in healthcare. The same is the reason why I think she picked my favorite topic and she asked me. Then I said, fine. So that is how this topic came into the reality for discussion in today's session. And I also got some awards, this, that, etc., some recognition, and some book chapters by my student, along with my students. And in fact, my own two children also as a co-authors of me, along with me. And I'm also a half marathon runner. At that one point that Sneha was not aware, so or may not be aware. So I'm also a half marathon runner, or 3/4 also I have completed, and the full marathon is due. I hope I may be able to do very soon. And I call why I am sharing that half marathon or something like that. And of course, I was also a member of a few healthcare professional organizations, particularly emergency medicine and things like that. Okay, so this healthcare, or rather the annual half marathon participation or 3/4 marathon participation. So far, I have completed about 12 of them, right from 2013. And earlier also I was running, but it was small. So why I'm saying this, I take this annual half marathon participation as my self medical or health checkup. Not a medical, but at least a proxy to that. I take it as a health check rather than annual health check than competing with anybody. I say I compete with myself. So that's one message I want to pass on. And another message I want to pass on, because you're all young doctors and medical and healthcare professionals. I have changed a number of organizations, though it is in the same academic and academic research kind of thing. I have moved from one organization to another organization very frequently. And of course, my current organization is the longest serving. 13 years I have completed. In fact, yesterday, my 14th year started at IIM Lucknow. All these changes are good, but let me also tell you, any change comes with a huge cost. So let me give that uncalled for, I don't call it as advice, but information sharing or experience sharing. Any change looks good, but every change comes with a huge cost. So please note that point. Okay. Right. So my suggestion to many of you, that if you want to shift your current job or maybe job in future, so please make that note. Everything comes with a cost. Right. Let me put that aside. Now coming to healthcare, or this is what is going to be my simple flow or outline. Very quick introduction, and then some aspects of supply chain, retail supply chain or commercial supply chains, and healthcare supply chains, and more specifically public health. I'll be sharing a few insights or few aspects of public health or healthcare supply chains of Tamil Nadu, UP, Andhra, At national level, we have a very profound program, including Ayushman Bharat and the vaccine supply chain or vaccination. And of course, now you must be seeing that HPV vaccination is another big project of the world. And also, I'll try to draw some parallels with the NHS of UK, and maybe followed by some insights and conclusions. Does it make sense? Okay. So now, how many of you heard about this called Silk Route and Spice Route? There is a what do you call that? A troupe, orchestra, troupe, or whatever that is. The music troops, what they call Euphoria, Silk Route, the music bands. There is something called Silk Route. Are you aware of that? I'm not talking about that Silk Route here. Sneha introduced the topic very nicely. When there was a cholera in early days of the earliest part of the last century, a lot of people died. And of course, this time, the 2020 or 21, during COVID time, again, lot more people died in spite of advancements, this, that, etc. And everybody was thinking that the entire world, thinking that, we can manage, we are the world's best, this, that, etc. World's best countries also failed to save their people during COVID. It's as simple as that. There was oxygen, there was a medicine available at one. There are PPE kits, there are ventilators, there are drugs, there are everything that was available, if not sufficiently, but to a large extent. But they failed to make it available at the time where it is required. It is precisely, if you talk about COVID, it was a invisible COVID virus versus the world, particularly the supply chain world. Okay, so if you really look at what is this Silk Route was supplying those days, more than, I would even say, centuries old. You can go back and check when was this Silk Route and the Spice Route started, why it was started. Though it was international trade and culture, what was being sent through Silk Route, what was being sent through Spice Route, and of course today we're talking about maritime supply chains. India was supplying pepper, cloves, cinnamon, and nutmeg, and so on and so forth. Several other herbs, aeronautics, pearls, ivory, fine textiles. See what is being sent through Silk Route. Spice Route. It is not just spices, but several other things which are essential. Started with the spice. The spices were the medicines those days when there was no allopathy or no other alternate medicine. For people during winters, particularly the coldest areas of the world. That was internal medicine. The China and other parts of Asia supplied silk, which was the warm winter clothing to protect people, to save people. So actually, the world's largest business is the health products, either it is medical or non-medical or including food. Can we say the food is a part of essential things? There are cases where patients were survived due to medical treatment but died out of hunger. How many of you are aware? How many of you are aware? You can check. There was a first kidney transplant case of IIMS Delhi. The patient survived for almost close to a year. After a year, patient died. just because he was able to buy the medicine with all the resources that he had, but not able to feed himself with the basic minimum requirement of food. The patient died out of hunger. Can you imagine? So now tell me, is food a part of medicine or outside the medicine? People say, doctors say that please take this medicine after food or before food. There are medicines to be taken. There are treatments or other protocols that need to be followed before or after food, or 1 time, 2 times, 3 times a day. There is a standard operating procedure or drug administration. To be more, the drug to be more effective, you should also have a good food or acceptable food. Otherwise, it can react. It won't serve the purpose, that it can become unsafe. So according to me, even including food supply chain is also a part of public health. Now, let me ask you one thing. How many of you are facing a shortage of water and non-potable water? How many of you drink water in your office or at home safely without thinking that the water is not safe? Is the water is a part of public health? Yes or no? Yes, water is a part of the public health. Food is a part of public health. Health and hygiene, sanitation is part of public health. Now let me ask you, what is the Swachh Bharat, orphan defecation free country? So I'll ask these things in a while. So now I understood what is the difference between those days supply chains and today's supply chains, according to you. Now you see this. The temperature at which these products have been moved is also very important. Otherwise, the purpose is not served. So the infrastructure, when the items are moving from such a long distances, see that 6,400 kilometers. Even spices were traveling 25,000 kilometers. What happens to these while they are in transit? See these numbers. Now look at these millions of connectivities. Millions of connectivities, over 1,500 years of cultural and economic exchange. Supply chains are not supply chains. Supply chains are the integral part. Without supply chain, there is nothing. These supply chains deals with both products and services, information. We talked about flow of physical product, flow of money, flow of information, flow of people, flow of skills, flow of knowledge. Everything is a supply chain. At the end of the day, I want to say our survival is a nature, is a supply chain. What connects, what runs the society, the world is the supply chain. It is like a spine of a body, human body. Without spine, no body. Human anatomy and the supply chain. Now you are the doctors. How complex is the human anatomy? Doctors, PG doctors, please come forward. How complex is the human anatomy, human body? Are you there? Very good. The highly connected network. Supply chain is like a nerve system. If any nerve fails, human body function fails. Human body is analogous to supply chain. Do you agree, Dr. Lakshya? Then what is the problem? Why can't we design? The God has designed us. We are managing the body. The doctors are managing the so complex system. Can't the doctors manage the supply chain? Tell me, doctor, are you a supply chain manager or not? Are you a supply chain designer or not? Every doctor by profession, you are the best supply chain specialist. Absolutely. You hit the nail on the head. Wonderful. Wonderful. So let me also tell you, don't take it otherwise, Sneha also. We are doing a program for healthcare experts or healthcare management. Both doctors and non-doctors are our students, including super specialists. So take a look at our healthcare program. I'll share the healthcare program brochure with you, Sneha, and you can disseminate within your network and let there be at least information about what we are doing. Okay, right. Thank you. Now, the next, coming to what is that one uniqueness of any solution? Any solution. Supply chain is a solution to a problem. Do you agree? Supply chain is not a problem. Supply chain is a solution to a problem. Supply chain is a solution to almost all problems. Patient flow is a problem. Ambulance is a solution. So emergency supply chain, emergency care. Public disaster, including cold waves, heat waves, floods, natural calamities like COVID. These are all problems. All these problems can be addressed through several things. One of them is the supply chain. Do you agree? During COVID time, drones were used to deliver medicines. Now, none other than Kanpur in UP, drones are being engaged by a restaurant to deliver food. Sneha, are you aware? It is there in the social media. I have not yet seen. Then you should actually call that guy and then ask him to do a session on how to deliver medicines in UP using drones. Yes. So a solution is not a solution unless it is affordable. So cost is the main thing. Are you able to afford? Are you able to travel by air? Are you able to send your medicine by air? Are you able to send your samples cost-effective way, time-effective way? Affordable. Affordability has two dimensions. Doctors, tell me, what are those two? One is cost. Another one is, it is the time. After affordability, one is the cost, another is the time. Rural poor people have cost issue. The urban poor has not only urban poor, even urban rich has a problem of not having time to go to doctor. And hence everything is home delivery now. The technology has changed. You cannot go to a restaurant can come to you. You can't go to hospital can come to you. Particularly public health. Please note this point. Instead of making the large groups of public to go to the hospital, one difference between public health and non-public health, or rather other part of the different care, is that if the public health volumes are large, for example, flood relief, addressing post-flood relief, floods, health issue, health hazard. Doctors and medical professionals goes to the field, serve them. The normal patients, for example, cardiac care. Cardiac care patient goes to the hospital. Hospital-based care, field-based care. Now, you see the difference. Public health is where the health is delivered at the doorstep of the people. Screening for malaria, screening for something else. Now you might have seen screening for COVID. Now you can look at screening for TB, screening for several communicable diseases. See the difference. Hospital-based care, the public facility-based care, I mean at the doorstep of the people. For example, Anganwadi. Now I am going to ask you a few questions. I think Sneha, can you message all of them and then see whether they can participate in this exercise? Now, how many of you read the recent newspaper just last 2 days? I didn't note down the exact date of this. It came in the Hindu newspaper. You see this 2013-14. Of course, now for everything the benchmark is either COVID or before COVID. It is 2013-14. I hope you all know what is the reason. All right. That is the reality. Now you see in 22-23 from the Ministry of Health and Family Welfare numbers, the WHOOPS percentage. WHOOPS means out-of-pocket expenditure by the patients at the country level has reduced from 64.2 to 43.4. Okay. Out of total health expenditure, I think the terminology you must be aware. And of course, national health accounts, etc., etc. Please be aware of this terminology that has been followed in the public health or in the health in the context of health. Okay. So out-of-pocket expenditure has significantly reduced, right? If you look at it from the percentage point of view, it is almost 20 upon 64. You can calculate that percentage decline, percentage decrease. And the government health expenditure has increased over the decade. In the last more than 10 years, the government spending on health has increased significantly. And the world's largest program is IIM Bharat Wellness Centers, Health and Wellness. Health and Wellness. Is there a supply chain in health and wellness? Yes or no? Anything delivery means anything is a supply chain. Each and every transaction is part of supply chain. I would say the world is served by the supply chain, including we all are the part and parcel of the supply chain. One way or the other, you are part and parcel of several supply chains. For food, it is different. For education, it is different. Now, let me ask you one more. What are the reasons for it? So please read news articles related to something like health and public health or even other healthcare. Now, the free medicines and diagnostics in public health facilities. We go to Tamil Nadu, of course, that's what I'm going to share. There, the public health system is far better than any other state in the country, followed by other states like Kerala, Karnataka, Andhra Pradesh, and now, of course, many northern states are also doing well. I'm going to share what UP is doing, particularly in the last almost 7-8 years. The higher public awareness and insurance coverage. Is the insurance part of supply chain, health supply chain? Now, what is the impact of IIM Bharat in UP health indicators in the last 5 years? Sneha, I think you should do a good supported research study for UP public health. So you catch hold of some good key people and try to do at least a few selected districts. What was the impact of or influence of Ayushman Bharat, and of course the insurance, public health insurance scheme like Ayushman Bharat. Okay, right. So world's largest program is Ayushman Bharat. Right. Now let's look at this supply chain. So is my point clear? What is this? So oops, what is the supply chain? Right? General. Okay. Now coming to what is a retail supply chain? Let us say Blinkit, e-commerce, Amazon, Flipkart, urban company, anything for that matter. Let us take a big basket. Is it a retail supply chain?
Yes, sir.
Right. One or two doctors, please. Do you agree? In our life, there are multiple supply chains. Your life is simple and stable and happy. That means your supply chains are good. No, let me give you. The best countries in the world are the ones having the best supply chains. Standard of living. Your one word answer, what is the supply chain? Higher the standard of living, better the supply chains of that country. If you look at the southern states are better standard of living. I'm sorry to use this regionally biased or regional example. I don't call it as a bias, regional example. Suppose you want to stay, you want to reside in a state in India. Which state you will prefer and why? Let me ask Sneha. Sneha, you given the chance, you have a choice to choose where you want to live, including UP. Where would you like to live and
Sir,
why?
UP has definitely, the supply chains have improved in the last few years.
No problem. Let me ask you another more specific. Suppose outside of UP, let us say, other than your home state, if you want to stay, stay anywhere, which would be that state or a city, and why?
Sir, I've heard about Tamil Nadu also.
Okay. Any city, any specific city? If it is by city wise, which city?
City-wise, I think Chennai or in UP it would be Lucknow.
No. Other than UP, I'm asking.
Other than UP, Delhi is also good.
Very good. Why Delhi?
Maybe because of the logistics, maybe because of the facilities.
You have a standard of living completely different compared to any other place. Metros are, let us say, for example, metros has many advantages, of course, equally disadvantages also, but many advantages are there. You have a good health, good schools, proximity to several things, and standard of life, and maybe cost of life, living cost may be high, but standard of living will be better, etc. Right? Now, if you look at similarly, the best countries in the world are the ones which are having the best supply chains. The best companies in the world are the ones which are having the best supply chains. So you want to be your best, your supply chain should be best. You want to be a best, let us say, between Shivam and Sneha, if you both of you want to be best, or who is going to be best, whoever is going to manage their supply chains better, they will become better. Do you agree, Shivam? Right. So the supermarkets receiving snacks, clothes, electronics from suppliers, and storage and delivering and payments, receiving payments, converting that into something, then reconciling and making the payments to the suppliers. So there is a money flow. In retail supply chains, what all there? There is a information flow, there is a material flow, there is a funds flow, basically. Whereas in healthcare supply chains, in retail or product supply chains, the tangible products are moved. Whereas in healthcare supply chains, of course, in the product supply chains, there is a discretionary. You may like, you may not like, you may want, you may not want. There is a choice. Whereas healthcare, there is no choice. It is a need-based. Healthcare is a need. Do you agree? So healthcare supply chains are compulsory. Healthcare is not a choice. You want to buy a mobile, there is a choice. When there is a medical problem, you don't have a choice but to go to the hospital. You may not be able to go, that is a different thing because of several reasons. That's why now public insurance coming to picture. Right. The process of delivering treatment is a service part. Then medicines, medical equipment, supplies, to hospitals and patients. And today you can deliver home delivery of medicine. How many of you are aware of Janaushadhi, Pradhan Mantri Janaushadhi Kendras? You can even set up your own Janaushadhi Kendra by taking, it's like a PCO. You can do that. You can become an entrepreneur. You can run from your home. I have a friend in Srikalahasti. I come from a small town, nearby a small town, Srikalahasti, in Andhra Pradesh, a village. In Srikalahasti, there is a retired, there is a press person. He was working in the press, media. He quit that and he started the Janaushadhi Kendra from his home. And a doctor comes few hours to that clinic. He created a small clinic. Actually, I am thinking of setting up like that in my village even. And 30, 40, 50, 80% less on MRP. So look at that. It is because the supply chain is making that happen. How come these medicines are able to give 40, 50, 80% discount on MRP? Just imagine of then how much is the margins. Right. So hospital receives medicines, gloves, oxygen, PPE kits, blood. Forget about this side. Now, biomedical waste. Disposal of waste is also a supply chain. Do you agree? Municipal waste is a big problem. If you are not clearing the waste, it will going to create a public health hazard. Look at Delhi. Look at Delhi in the winter. It's going to be a gas chamber. It's a poison. Right. So retail supply chain focus on customer products and sales, whereas healthcare supply chains focus on patient care. You are dealing with people, human beings. Of course, in the other case also, human beings only. When you are selling a food and you are selling a mobile phone, there is also a customer. He is also a customer. He is also a human being. Here also a human being. But here the human being comes with a completely different mindset, different condition. A pregnant woman comes to a maternity clinic is different. Do you agree, doctor? Right. And timely delivery of medical items. Suppose if somebody, now who is from Gorakhpur? Who is there from Gorakhpur? What has happened in Gorakhpur Medical College? What has happened?
The Japanese encephalitis.
There was a shortage of or disruption in oxygen supply much before COVID because of non-billed payment or so, if I'm not wrong. So there is a disruption in the supply of oxygen. Number of children died. There was no equipment, ventilator. Children died. So the IAS officer who has procured is a good friend of mine. And timely procurement of ventilators saved several hundreds of children, several hundreds of children. So running a hospital is completely different from running any other business. Running a public health is not a joke. Creating acceptable, for example, community medicine. As an expert in community medicine now. Community medicine is the most complex supply chain. Make that community medicine guy to work with you people and see in the last few years, the last 10 years in UP, what was the improvement in community health. I think these are the kind of things that you should do, my dear doctor who is doing community health, community medicine. How UP Medical Supply Corporation has changed their health indicators of UP. I think that is the kind of studies that you should take up, Sneha, and your organization. So whatever that I can do for you, please let me know. Right. So healthcare supply chains are complex, diverse, and dynamic, and increased complexity of numerous organizations involved with the multiple points of interaction. The variability resulting from providing each physician, pharmacy, and their specific product preferences. For example, you write a crocin, I write paracetamol. There's a huge difference, right? And distinct supply chains. The way you deal with drugs, the way you deal with the PP kits, consumables. For example, OT towels. For example, PP kits. For example, diarrhea medicine. A medical device, a dialysis equipment, an X-ray, a ECG, portable ECG, a spectacle as part of your public health scheme, clothing, linen, syringes. Every product is almost like a different supply chain. Each product is a unique, and it is a supply chain. Yes. So this is what is the two sides of healthcare supply chain: time, cost, and waste on delivery side. The left-hand side is the development side: equipment, devices, consumables, drugs, so many things. From supply to delivery. During COVID, what happened? We have developed our own PP kits. We have developed our own X-rays. We have developed our own vaccine, the ventilators. We have developed our own vaccine. We have supplied to several countries. So I have a few things. I will take another 5 minutes to 7 minutes and close, Sneha. Is that okay? Right. So now give me some examples of public health schemes, public health programs. One of them is IIM Bharat. Now, the National Health Mission, there are a number of programs. For example, TB control. Now, what do you call that? Dots, right? NACP. Yes. Vaccination. Nowadays, particularly HPV vaccination. Next, polio vaccination. Yes, Swachh Bharat. Open defecation free. Open defecation free. ODF. Ocean program. Yes. Anganwadi. School midday. Midday meal. Are you aware? Now, tap water supply. E-Janani. E-Janani. Janani Suraksha. Indradhanas. Chiranjeevi. Chiranjeevi program. HIV kits. Particularly for truck drivers. Next. Do you know egg program? Egg is the nutrient food. There are the poultry farms managed by government.
Yes, sir. And with
Yes. Government was taking care of the eggs for people also, you see. India is a great country, let me tell you. It's not an ordinary thing. And that too, a state like UP, everything is a 5 times opportunity. 5 times. Because nearest state is 1/5 of UP. In the second largest state in the country is the 1/5 of UP. UP is the 5th largest country in the world. Are you aware? Right. Next. Egg distribution. Next. Ration, leprosy. Yes. Leprosy. Smallpox. Malaria. Yes. Namami Gange. Wonderful. E-Sanjeevani. Yes. E-Janani. E-Sanjeevani. Yes. E-Sanjeevani. Next. Anything else? Most important. 108 EMRI. So, behind all these things, most important thing is policy and implementation. So, before you think of anything, you should look at what is the policy of the state or the country. By the way, is the health is a state subject or a central subject or both? It comes under concurrent list. Certain things are national level, certain things are state level. For example, this IIM Bharat is a national program. Janani Suraksha is a national program. Eradication of blindness, cataract blindness, needless blindness is a TB control is a national program. HPV vaccination is a national program. National level COVID vaccination was a national program. Many of these things are national programs. States also participate, and the implementation responsibility comes into picture both. Right. So let me move on. It is time. So public health supply chains are availability of medicines, vaccines, diagnostics and equipment, etc. And the strong supply chains improve the healthcare access, equity and resilience. Do you agree? Equitable healthcare. When you talk about equity in healthcare, it is the healthcare supply chains that is the mechanism. Equity in education, equity in health, right? It is a government mandate. Equity in wealth is not the government mandate. Government is not responsible for maintaining everyone's income and health equal. Equal health, equal education, equity, access to everybody, right? And public health systems depends on efficient procurement, warehousing, logistics, and data systems. Please note, data is also very, very crucial. IT infrastructure, right? So let me take you to quick examples of TNMSC, Tamil Nadu model. Yes. So Tamil Nadu is the one of the states which have implemented public health supply chain very, very early 90s. It has become a wonderful benchmark. So I'm going to take you very quickly to that. It's a centralized procurement and decentralized distribution. You know what is meant by that? Yes, essential drugs. Government is procuring, is responsible to produce essential drugs, which are the essential basic needs of the people. According to WHO, there is a list called WHO Essential Drug List. That essential drug list depends on the different states. It is a different states needs different essentials. For example, in a village, what drug you need is different from a city. Right? So essential drug list is precisely the list that is generated by following the WHO guidelines by the health ministry of the state. And they are responsible for procuring that as a part of their supply chain. If you buy every hospital, the cost is going to be much, much higher. Do you agree? If you buy entire state's requirement and one go, if you release a tender at a state level versus release a tender at every hospital or district level, it is going to be different. That's what is our Honorable Prime Minister is now saying. One country, one subscription of journals, even at the libraries of the education institutions. It is like your requirement, your parents' requirement, combinedly procuring. Are you getting the point? Yes. So transparent e-tendering reduces the corruption and the procurement costs, and scientific inventory management that minimize the stockouts, and widely recognized as the best practice model in India and in fact outside India also. It is a WHO certified model that it is good model. What are those elements of that model? Look at this. I'll stop with this and some more examples of that. That's good enough. I'll stop with Tamil Nadu model. Of course, I'll just introduce UP also. You have to estimate what is your requirement first. Forecast. What are the forecast of drugs? Various drugs. Let us say 200, 300 drugs. What is the requirement of each of them when you want to go for tender, calling for tenders? Then comes, you release the tender, the bids processing, then order processing, supply monitoring, warehouse management, quality control, stock monitoring, bill processing, use the technology like barcode in 90s. Please note, Tamil Nadu health system has used the barcode in 1990s, and including pharmacy management and MIS for monitoring and evaluation. And please note the last point below, passbook system. You know what is passbook system? How many of you have passbook? Is there anyone who is not having a passbook, including digital passbook? Passbook, bank passbook. Why do we need bank passbook? Very good. It tells you what is the deposit. Whenever you deposit something, there will be entry. Whenever you withdraw, there will be entry. Whenever you deposit or both you do, on a given date, you know how much money is available as a balance in your account, right? Same thing is being done for every hospital by introducing a system called passbook system. A CMO of a particular district knows how much he has consumed, how much more is left. It is like a budget. It is like a money in your account, right? So these are the elements of public health supply chain, the most versatile. Now, what is the impact of these? Are critical success factors of this? What is the reason behind this? Is effective leadership and political support. Please note, political support is a non-negotiable element of the critical success factors. Then multi-stakeholder participation for political buy-in. So doctors, all the systems have to be in place. Suppliers, producers, distributors. It is a collaborative system. Please note, public health system or public health supply chain is built based on the collaboration and cooperation of all the stakeholders. The community medicine guys will face this problem. Now, sufficient budget, there should be a financial resources. Then comes outsourcing of non-core activities like IT, quality testing, supply chain, etc. And autonomous procurement agency. It should not be controlled by political influence or other things. And well-defined localized EDL, that is the essential drug list. Scientific demand estimation and forecasting. Effective pre-qualification criteria. You have to fix the conditions such that good people will qualify to supply the various things, services, products and services. The protocols for regular inspection of supplies, including inspection of the supplies. For example, you might have seen recently also that a lot of medicines have been outdated, expired. IV fluids were contaminated, and mandatory external quality testing, autonomous payment body, and scientific warehousing systems, real-time stock monitoring, dedicated vehicles for warehouse, and robust IT systems. So these are the elements of, these are like your medical specializations, like ENT, cardiac, eye, skin, or gynecology, whatever you can think. Now you see these are all your specializations, medical specializations and supply chain specializations. These are the supply chain elements, right? So before and after, what has happened? So as a result of this, you can see here, out-of-pocket expenditure has gone down drastically. 145 rupees per capita against 2,284 in the country. Please look at this. In 2014, almost 12-15 years back, 92% of OPD and 97% of IPD patients receive the free and partly free medicines in Tamil Nadu. Whereas in the OPD patients, 42% and 54% IPD patients receive the same in Uttar Pradesh. To increase this, Uttar Pradesh budget has to be significantly scaled up. Uttar Pradesh economy is different. So your public health budget drives this. Public health budget, public health policy drives this public health supply chain. Please note that point. So there are some of the other things like availability in UP versus Tamil Nadu and Rajasthan. These are the comparison of public health supply chain parameters. Mean availability of essential drugs, availability of PHCs, CHCs and district hospitals. 90% of the district hospitals are available in Tamil Nadu and Rajasthan, whereas in UP it is 70%. So, see the impact of public health delivery by public health supply chain. If you have a good healthcare system in your state, that means there exists a good public health supply chain, or not so good public health supply chain. Now tell me, out of these three states, UP, Tamil Nadu and Rajasthan, which state you would like to live? With that, I will stop here. If you go further, Pondicherry. If you go further, Kerala. Why people want to go to UK? Why people want to go to US? Why people want to go to Europe? In Europe, much better. In fact, the Kerala health indicators and Tamil Nadu health indicators are far better than the developed countries. Please check. In UK, wait list is months. Forget about health. Even today, for a vehicle, automobile vehicle, people have to, doctors are waiting in UK for a vehicle. And we call them as advanced country, developed country. In India, almost 90% of the vehicles we can get door delivery. Health services in India is far better compared to any other state, any other country, or most of the countries. Let me tell you why I am located in Noida. Again is Lucknow. I have an option of Lucknow and Noida. I prefer Noida because there are number of health organizations, hospitals in and around the place where I am living now. So try to find one of the most important factors for your stay is health and education. So I will stop here. There are a few other examples. UP, this was the before and after centralized procurement. For entire UP, consolidated procurement is happening now. Distribution, warehousing, a huge change. Tamil Nadu model is being adopted in UP. And in fact, I was involved, I was one of the members of designing this system, right? So this is the COVID supply chain during wave 2 in Mumbai. This is the AP cancer care model. Of course, UP has a TB model. So COVIN, you already know, vaccine distribution system, right? E-vaccine intelligent network. Now you can see, you can browse your network and then see, download your vaccination dose 1, dose 2. No other country has even today. Digital. Yes. So UK health system. UK health also one of the benchmarks, but we have a lot many other similarities, right? So UK versus this PPE kits distribution during COVID time. Then comes your India versus UK public health. India focus on scalability and last mile delivery in resource constrained settings. NHS emphasis on standardization, integration, and data analytics, and so on and so forth. And the both systems increasingly rely on digital technologies, no doubt. And we are much faster than or advanced than any other country in terms of digital. And public-private collaboration is important in both the countries. So please note, there are public-private partnerships. For example, this Jan Aushadhi scheme is that. Okay. So how to strengthen this? Build resilient and diversified supply networks, including cold chains, promote interoperability and real-time data sharing. And of course, you can reduce the hopes in this country much, much better by adapting to public health supply chain practices. Is there any doubt in any of your mind, even now? So you need policies and reforms for affordable care. So I will stop here. And what we need is the understanding of demand side and supply side, affordability, accessibility, and awareness, and accountability, adaptability, and alignment with the stakeholder interest is on the supply side. Of course, this is the framework that I have developed, and of course, I have published it also. So you need to find innovative solutions for this. So I hope you understand the need and importance of public health supply chains in improving the standard of care any place, including India or at state level. Okay. So it is not a one-man show. It is a teamwork, interdisciplinary. Everybody has to go in hand in hand. So this is what is one picture that I can share. And finally, you have to be innovative. You have to upgrade your skills. Particularly doctors can make a lot of difference. Medical professionals can make a lot of difference in healthcare anywhere in the world, provided if you see outside of your area. My sincere submission to all of you, please come out, please open your ideas, your communication channels. Doctors have to listen, no doubt. Doctors also have to speak whenever it is required. Okay, don't take it otherwise. I think Sneha has done a wonderful job. Thank you, Sneha, for giving me this opportunity. For of course, I got some more clarity about what I have been doing. Thank you for that. And if there is any queries, I'll stay back for next 3-4 minutes and then we will close it. Right. Thank you. Thank you for all your patience.
Thank you. Thank you so much, sir, for your time and for a wonderful presentation that you gave. Any questions? Nikhil, Vidalson?
Yes.
If you see the pattern of healthcare delivery in this country, hoops are very high because lot of public players, lot of private players, that too small and medium is many and bigger players are very few. The primary care in many states is at a very, very low accessible level, mainly because the lack of infrastructure, lack of proper incentives. The doctors are the medical professionals, including nurses, nursing care, are the ones who are migrating much faster than any other people, any other category, or any other segment of the educated population from India to outside. You might have seen recently also that in Tamil Nadu or other national level, I think it is in the state, I think it must be in the state of Kerala. More than 50% of the people their earnings are less than 50,000 a month. That is one part. The second part is government cannot do everything on its own. The private has to join the hands with the public to do this. Like I will give you two things. It's actually the insurance. It is not the government insurance, the government supported insurance by the insurance companies. It's a public-private partnership for insurance, health insurance. Similarly, 108 is also under public-private partnership. I don't know whether you are aware or not. Now, under that, IIM, CT scanners, MRI machines, and several other services inside the government hospitals, you've been provided by the infrastructure, and a few other things are by government, and the maintenance and operation is by the private. For example, if you see in IIMS Delhi, the pharmacy is maintained by HLL. HLL is a government organization, once again, but still it has formed as a different entity to take care of this. Similarly, several other places. For example, in Andhra Pradesh, the third party takes care of a lot of admin related stuff, approvals, paperwork, etc. I'll give parallel examples in public service delivery. I will call it as public service delivery. And public service delivery can be made much better and efficient by collaborating with the private. That is the key. Which is happening outside India also. Several other places it's happening, but in India it is taking up. It is picking up much faster, and we need much more speed and efficiency in that. Yes. Yes, please.
Sir, one question from my side also.
Yeah, please. You are free to ask.
Yes, sir. So, with so much global supply chain vulnerabilities increasing with the crisis in West Asia and other way, how do you feel? What is the way forward for an Aatmanirbhar India?
We are already almost, I would say, close to 50% or more than 50% on Aatmanirbhar. And these kind of incidents like COVID has made us to develop our own systems. Crisis makes people stronger, even including individuals. If you've gone through some terrible experience or rather terrible time, after that, you will become much stronger and much better. The same thing is true for government. Same thing is true for countries. These kind of disturbances are actually making countries much better and different and self-reliant. For example, in terms of health, I'll quote a few examples of COVID. During COVID time, there was no PPE kit manufacturing in the country before. During COVID time, we built a lot of things. That was the time where our Honorable Prime Minister Modi ji started this Aatmanirbhar Bharat, including for toys. It is not just manufacturing is sufficient. Consumption also. We have to consume our own products. India should focus on consuming our own products made in our country. Swadeshi, precisely. Because the vulnerabilities are going to increase. It's not going to decrease. It is a natural or man-made. COVID was a natural. The wars are man-made. Either natural calamities or man-made calamities are going to, disturbances are going to take the economy hit. So only way to do that is localized distributed systems. So our supply chains have to be more resilient and more distributed. It cannot be completely dependent on others. Even including within the country, one state to another state, we should create enough amount of resilience, or rather, let us say, cushion. For example, food grains. For example, fuel. For example, now EV vehicles, solar, energy. If you have a hospital, if there is no gas, what will happen? No oxygen. So we have to create our own resources and you start consuming that so that you will be able to reduce the cost. Creating capacity and scaling up and using technology and collaborative models. This is what is the most important thing to make our country Aatmanirbhar Bharat in any dimension. Yes. You come from rural or you come from urban?
Sir, I come from mostly rural, semi-urban.
Semi. You go to the interior part of rural today. The children in urban and semi-urban are wasting their time, and including the elders, are doing nonsense on digital media. Many children, particularly those who are progressive and developing, they are using technology for development and education and economic development and education. I'll supplement this. We did an impact assessment study for UP on the devices that have been distributed by UP government, smartphones and the tablets. The first time users, their academic performance, their awareness, their development is significantly different from others. So what content? It is not about the digital. How you are using this digital? Are you wasting your time and energy for non-developmental activities? What are the developmental activities? One is education for youngsters and employment generation, or connecting to economic related activity. I'll give you a very simple example of Tamil Nadu. The Tamil Nadu fishermen were using, this is what quoted by Dr. APJ Abdul Kalam sir also. Before going to the market, they check the market prices on mobile and call them. If it is a market is fine, they will go there. Otherwise, they will not go. So this is how digital has to be used. In fact, the same thing is happening with the farmers also, agriculture produce. Just check how they are using. I'll give you one more. While growing the paddy or growing the crops, the farmers are using these smartphones or even other not so great smartphones to convey to the condition of the crop to the agriculture scientist and get the treatment protocols or rather advice for that. So these kind of things are happening. So digital is a wonderful tool, but how are you using it is very important. Doctors are now the best example. The care delivery remotely is possible now. Right?
Yes.
Yeah. Okay. What else?
Any other questions? I don't think so, sir.
Right.
So thank you, sir. Thank you so much, sir, for your time, for your presentation. It was a pleasure listening to you. We had a wonderful learning experience sitting here for more than 1.5 hours.
Yes.
And thank you so much, sir, for your time.
Thank you.
Thank
Thank
you.
you.
Thank
Yes.
you, everyone.
So I'm sharing these slides also with you, Sneha, right away.
Okay, sir.
So please use it, and you may even share with all the participants. But ask them to restrict to themselves. Do not post here and there. That's enough.
Definitely, sir.
That's more
Also,
than-
taking forward your suggestion, we will also work on some initiatives on Uttar Pradesh.
Yes.
Studying on some districts the impact of various.
Just take a simple district, then try to do something and see the impact of these things over a period of time. which will
Definitely.
make, you don't take up a too large a study to start with. A small one is enough. A sample size of about 500 to 1,000 households. What was the influence of IIM Bharat or specific to UP schemes or something like that. Okay. Particularly on community medicine. Take community medicine. Public health. What is the improvement in public health care delivery in a selected district? That's enough. Yeah, right.
Definitely, sir. Definitely.
Thank you so much. Once again, all the best, my dear doctors, and enjoy your studies and your future jobs, and make the country a better, healthy country. Right. Yeah.
Thank you.
Right. I'm taking leave.
Thank you, sir.
Thank you.
Thank you, everyone. Thank you for all your time and joining in for this webinar. Thank you.